Hello everyone, my name is Dr. Ankur Khandelwal and welcome back to my channel. Today we'll be discussing a topic which is medial epicondylitis, also known as golfer's elbow, where patients will typically present with pain in the medial aspect of the elbow joint. So this is a gentleman, he has come to us with pain in the medial aspect of the elbow joint. It's been around 1 month or 1.5 months. Let me tell you that he's very fond of driving. He's fond of some sports like he loves playing badminton and cricket. So the pain has been around for 1.5 months and there is no relief of pain. So you can elicit for tenderness in medial aspect of the elbow joint. दिखाई से So when I'm putting some local pressure, there is tenderness and he complains of pain, right? What is the common test for checking for medial epicondylitis or golfer's elbow? Just ask the patient to stretch the limb, put pressure and ask the patient to flex the elbow joint against the pressure, right? So I'm asking him to put the pressure against my hand. So what has happened is that the flexor tendons have become taut, right? And that is why he is now feeling pain. Asabik? Yes. Now he is complaining of pain. So this is the simplest and the easiest test you need to do for confirming medial epicondylitis. Though there is no point doing other investigations, right? So diagnosis is predominantly clinical. So what is the pathophysiology? The pathophysiology is that it's because of the repetitive use and chronic strain of the flexor tendons of the elbow, right? There are 5 muscles. So the tendons of these muscles get overstretched and inflamed. That is why it's a condition causing tendinosis, right? Where the tendons are affected. And over a period of time after the inflammation, there may be necrosis and there may be calcifications, right? So what is the treatment? The treatment is pretty simple. Ask the patient to avoid the ongoing insult. That is, we will tell the patient to reduce driving as much as possible for certain few days till the inflammation comes down, to reduce his sports activities till his pain comes down. Simultaneously, we can give certain anti-inflammatories like NSAIDs for few duration like 5 days to 7 days. That will help down to cut the inflammation and relieve his pain. Further on, if after some time even the NSAIDs do not relieve him of his pain, we can go for local steroid injections, which works very well, even though the evidence is not very robust. But in our setting, if after conservative therapy it doesn't work, the patient doesn't get relief, we generally apply local steroid injections so that the patient gets quick relief of the pain, right? So rest, you can go for some TENS therapy, local warming, all those are there, but by and large, rest for that rest of the flexor muscles for few days, NSAIDs and local steroid injections. This is in nutshell about medial epicondylitis or golfer's elbow. Thank you so much.